Today we are going to perform today we are going to perform this is Dr. Alabos Kachiwal, and I'm presenting the introduction of online free consultancy courses, and Dr. Kachiwal Pet Clinic and Surgery Center offers these courses under the supervision of Dr. Alabas Kachiwal, who has 36 years teaching and research experience and clinical experience. So we are providing online consultation, expert advice from anywhere, and on a telephonic support we provide the quick guidance and supervision and support to the veterinarians, especially the candidates who join this course. There are farm visits on call, and we provide the consultancy and the treatment diagnosis on a farm. We provide the student guidance for DVM and veterinary students. We advise to the farmers for pets and farm animals vaccination program um, of large animals, small animals, and pet animals, and we are giving health care, nutrition, and even feeding management for pet and livestock. Dr. Kashiwal Pet Clinic and Surgery Center located at Kasmabad Pakura Chowk in Habib Plaza. The available time from which we have to perform our education from 9 a.m. to 9 p.m. and we are serving the pet owners, farmers, students, and vets across Pakistan. So we offer this online course to provide the after completion of this program we are providing the certificate, and this is the basic try to bridge the gap which is in between the practice and the degree offering universities. They are not acquainting the students with a full experience of a clinical experience of the treatment of the pets. There are so many um, leukemias, there are so many courses which does not offer the Doctor of Veterinary Medicine degree, whereas we have to face all those cases. We are giving only an overview of such areas like ophthalmic surgery, like oral surgery, like the the internal otitis or external otitis, or a surgical ear canal surgery, or we are also do not provide the education in a dentist program like a BDS. We are do not provide the proper fully practically supported the orthopedic surgery, or even we don't have basically the after cases which may be removed by a surgical means. Um, This is the how to handle and constraints the wild animals or zoo animals. We do not have such a programs which may acquaint the student or the candidate or veterinarians with wildlife or even the fancy birds. We offers the degree programs in and we give a touch to meat inspection, even milk inspection, but it does not give a complete the information or awareness or the practical means for the to the students or candidates which are learning doctor of veterinary medicine. So there are so many medicines which we are using in a treatment of a different type of the diseases like parasitic diseases. We provide three type of the drugs or three forms of the drugs like pastries, like injection or even a drench. So anthelmetics are available in a drenching form, in a liquid form, in an injection form, and as well as in a tablet form. So it uh, provides the external and internal cover against the parasites. The Navagan powder is one of the powder which is prepared in water, and then we give a bath to the animals having lice, ticks, fleas. So external parasites are being killed by the Navagan powder. Whereas we are giving the antibiotics like acamycin, like chlorom 500, and even we provide the supportive therapy like phosphon, like amicom, and these are the liver tonics, or these are the supportive therapies which supports the animal in the form of a weakness. We also give a treatment to the animals for mastitis like tetra delta double action intramammary tube broad spectrum. It covers the all the mastitis, especially the bacterial infection by this intramammary tube. We also provide the drench to the animals, as I have told you. There is also the one of the homeopathic drug which we are using, that's the fibrofit DS in the mastitis, and even in a prolapse. We offer the prolapsin or a prolapse medicine to cure the prolapse of the uterus, prolapse of the vagina, and prolapse of the rectum. So Colorex is a medicine which we also give to the animals for digestive or the problem which causes as a indigestion or a loss of appetite. So Colorex is a best drugs which supports to cure the loss of appetite, and as well as it provides the cover for indigestion. Ivermectin is one of the drug which we are ivermectin 1% that covers the external and internal parasites, especially the gastrointestinal roundworms, including the lungworms, lice, mange, mites, ticks, and warbles are being treated with the ivermectin injection. Oxytetracycline, it's a very good drug, 5%, 10%, 20%. This is long acting, having a 100 ml vial or a 50 ml vial with a name of oxytetracycline. It covers most of the infections. Serax is one of the drench which is triclobendazole, which also contains levamisole, and 100 ml packing is one of the, or even a 500 ml or 1 liter cans are available, which covers the internal parasites of the large animals. In cure, this is the enrofloxacin. It is one of the enrofloxacin group, 20% or even a 10 ml, 50 ml, and 100 ml. In cure, enrotil, or even in a number of the names with trade names, enrofloxacin is available for the treatment of the respiratory diseases, or even intestinal diseases. The pain biotic contains a procaine penicillin, benzyl penicillin, streptomycin sulfate, and 5 grams injectable vial is available for the treatment of the. Even we are giving this antibiotic in hemorrhagic septicemia. Navasin is one of the oxytetracycline available in a 50 ml or 100 ml vials, and we also provides the treatment with the antibiotics having an infection. And mostly you are observing different animals like having a CCP, having the ETV, or even anthrax. So, or listeriosis, number of the diseases the oxytetracycline covers. This is a broad spectrum antibiotics. Diclofenac sodium, diclofan injection as also one of the drug, which is also nowadays it is coming with a melexicam. 10 ml to 50 ml that is available for the treatment. This is the NSAID which we are giving it for cover of anal the as an antipyretic, analgesic, or as an anti-inflammatory drug. Prednicot is one of the drug which is also supported with the antibiotics, and it gives the full cover. That's 10 ml or 50 ml vials are available. So prednisolone is one of the drug which is containing a prednisolone. It's very good in treatment along with the antibiotics. So Utavate pessaries are being placed in the uterus after the removal of a placenta, and even if we are removing the fetus along with the placenta, then we always put up 8 to 10 pessaries in the uterus, so that it may give a cover against the infection. Trimodin bolus is a trimethoprim sulfadiazine. It's a good blister for the diarrhea, and it gives a good cover against the calves diarrhea. Colimax is amoxicillin colistin. That's a 50 ml or 100 ml, and it gives a good cover against the most of the infections. And strep pain is one of the prepared procaine penicillin or streptomycin, which is available in a 50 ml or 100 ml, whereas the colistan is a colistin sulfate, which is 100 ml vial, is available for market. Whereas the vermic, that's ivermectin, and it gives protection against the skin diseases as well as for the external parasite of the skin. Gentavan is a 10%, that's the gentamicin sulfate, having a 50 ml or 100 ml vial available in the market. Whereas the Navazan, that's the drench containing levamisole, oxychlorozenide, and cobalt. This is one of the most popular formula, which is given in a liver fluke or even in the worms, internal worms. So this is coming in a 125 ml can, or it is also available in a 1 liter cans. The Zentin is a 10% solution, is a diadecyl dimethyl ammonium chloride drench, which is available in 100 ml as well as 1 liter plastic cans. And the Nilvam, which is working against the parasites, internal lung parasites, or even in intestinal parasites, is available for 50 ml per 100 kg body weight with a maximum dose of 150 ml. Sheep and goat always been given a 5 ml per 10 kg body weight with a maximum dose of 35 ml. Whereas the Nilzan, that's or Nilzan plus, that's 50 ml per 100 ml body weight, and the maximum dose is 150 ml to a buffalo and a cow. whereas the 5 ml per 10 kg body weight with a maximum dose of 35 ml to a sheep and goat. The Zenal, that's the for a camel, buffalo, or even a cattle, that's the dose is being given to the sheep and goat 1 ml for 8 kg, and this is also available for the 10 mg oxychlorogenide per kg body weight and 15 ml per 50 kg body weight with a maximum dose of 105 ml. So sheep and goat requires a 15 mg oxychlorogenide per kg and body weight 5 ml per 11 kg body weight, whereas the maximum dose may be given 20 ml. So you can see that the dose must be used in with the recommendation of the company, and these doses are being calculated after a long research. A single injection of a 1 ml Butalex for per 20 kg body weight, 2.5 mg per bupiravine per kg is usually sufficient for the protozoan diseases, and also the imizole is one of the very important drug which is being used as a 1 ml per 100 kg body weight in donkey, horses, or mules, and it is being given in the Babesia anaplasmosis or Babesia equi infections. So, 2 doses after 24 hours apart may be required to the horses and donkeys for a cure. Whereas the we can give a amoxi, we can even use a spectrozole intramammary tube to a non-pregnant animals during the um, parturition or near to parturition. If they are being used, it can cover the infection of the udder and even the teats. So the somatic is a growth hormone which is used for the lactating animals for milk production and for meat animals to increase the weight of the animal. So growth hormone, somatic, or even the boostin, these are the drugs which are available in the market for that may be repeated after 14 days, and these syringes are entirely containing the dose of a 250 mg. The FMD vaccine is also 2 ml subcutaneous or intramuscular, 1 ml for a course subcut or intramuscular may be given to the animals. So these FMD vaccine is preventive for foot and mouth disease, whereas the andactine, this is the ivermectin which is being given 1 ml per 50 kg body weight, and based on the recommendation of the dosage level 200 mcg ivermectin per kilogram body weight may be given. So the oxfendas SC, this is an enthalmatic that may be given to the animals on 100 kg body weight or even 60 ml for the 300 kg animal. Whereas the front line is one of the spray which is used for the pets, dog and cats, to kill the lice, fleas, and the ticks from the dogs and cats, and it is being applied to the for the external parasites of the dogs and cats. Whereas these the drencher, the bucket, and the vaccinator, these are the equipments which we are using in the practice. Whereas the bottles, nipples that we feed the animals with milk replacers. Whereas the bedido castrator or a blood stop powder are used to dehardening purpose. The blood stop powder for a dehardening, and the bedido castrator for the castration of the large or even small animals. Like a sheep and goat are being castrated with the bedido, and as well as the bull and the sire is being castrated with a large body. So the tagging is one of the method by which we identify the buffalo cow, even to keep the record of the animals after tagging, so that we can identify all the animals after tagging and then keep the record. Thank you very much. Allah Hafiz. See you again.